Hello, and welcome to this medication awareness taster session for social care staff. So, my name is Laura. I've worked in health and social care for over 15 years now. I am trainer qualified, and for the past 5 years, I've been delivering professional training to staff teams across residential and supported living services. So, medication practice is one of the most important and riskiest areas in care. In this short session, I'm going to share with you the most common mistakes staff make, why they happen, and how you can avoid them. So let's go on to the second slide. Medication errors are one of the top compliance issues picked up by CQC. That's Care Quality Commission. Good medication training doesn't just tick a box, it protects the people we support, and it builds staff confidence, and it keeps services compliant. And this is what we want. Getting it right keeps everyone safe, residents, staff, and the organization. As a care staff, we have a duty of care. That means administering medication safely and in line with the law. You must follow CPC expectations and NICE guidelines. So NICE guidelines is literally everywhere when it comes to care. So everything is pretty much by NICE guidelines and CPC. So this is like Bible of everything about care. And remember, documentation is just as important as administration. If it is not recorded in the eyes of CQC, it didn't happen. Everyone knows that. Okay. So here are some of the most common errors I've seen in services. So giving the wrong person the wrong dose at the wrong time. There are many ways of how you can check that you're the right person. A lot of people, I've been in the service where I went to administer the medication and it turned out they were twins, people with learning disabilities. They did not use speech to communicate. There are ways of checking the person's identity, obviously the time and the dose. So in terms of the dose can change, so if, for example, you go to the doctor to see the doctor, GP today, those could change in one day. Maybe you had a day off yesterday and today you come on shift, whether it is supported living or the residential, you find out that the dose has changed. So never become and never be complacent. So the second error is forgetting to sign the MAR chart. Again, the consequences could be fatal because the person could be overdosed, not checking labels or instructions carefully. So when it comes to instructions, so you could be in a situation where the instructions may be not clear, and it's important to check that you understand. If you're not clear, ask somebody, ask your superior. And if you don't get the answer or you're not satisfied that this is the right way, then what you need to do, you need to speak to the prescriber. However, if you're not sure about any of those things, you must not proceed with medication administration. When medication errors happen, the impact is huge. The person you support could be put at risk of harm. A safeguarding investigation may be triggered. No one wants to sit in the safeguarding chair. No one wants to go through the disciplinaries because it doesn't just affect you, it affects your family, it affects your pay. Pardon me. And you don't want to be in a situation where you made an error and you have to explain yourself to the relatives, families, to the person themselves that, listen, you trusted me. I was trusted with medication administration to keep you safe. And I didn't because I was either complacent or I was lazy. Right? So that's why it's so important check, double check, and triple check. If you're not sure. Staff could face disciplinary action, and the service could face enforcement action from CQC. The service could be closed down because of the medication errors or the medication not being administered properly. This is why consistent training and awareness is so important. One of the simplest tools to avoid mistakes, the five rights. So some organizations have 5, 6, 7, or 8, even 8 rights. But the main rights are the right person. So you need to have that right person, the right medication. You need to know that this medication that I'm about to administer belongs to that individual. And that is the correct medication, the right dose. Again, talking about the dosage changes, the right time. I'm administering it at the correct time. And the right route. Is it oral? Is it topical? Is it ear drops, eye drops? So you need to know all those things. These checks take seconds, prevent the majority of medication errors. So I'm going to give you a scenario. So let's look at the common real world situations. You go to give the medication to a resident, but they're fast asleep. It's the evening. What should you do? So you don't just leave the medication on the table, or you don't skip it. You don't skip it either. The correct action to follow your service protocols, documented clearly on the MAR chat, and escalate if necessary, because it could be for different person, for different medication. Could be a different scenarios what you would have to do. If, for example, something like 6 months for one reason or the other, if it's like PRN medication, then you can skip it. But again, you need to go down and you need to see the right documentation for the person. And until you are satisfied, again, you do not proceed. The scenario, PRN. So I mentioned PRN medication earlier. So what PRN stands for? It stands for as needed medication. So before giving PRN medication, you must always check the PRN protocol. So each individual would have their own specific PRN protocol, which is person-centered, meaning it's according to that person and that person only. So before giving PRN medication, you check the protocol and what you must record. So you must record the time given, the reason that it was given, and the effects afterwards. Again, you need to know what medications you are administering. You need to know the side effects of specific medication, because if you are administering medication to someone that don't know or not aware of and forgot the side effects of the medication, you are in charge of it. So the information you're going to see in PRN protocol is also when to give that medication, when to administer that medication to a specific individual. How would you know? How would they communicate with you that they require or they would need medication if they don't use speech to communicate and so on? Because here we're talking about different settings. Homely remedies are everyday over-the-counter medicines. Every care setting has them, but they still need proper authorization and recording. And covert medication is hidden medicine in food or drink and can only be given after formal best interest decision has been made and is recorded. So this is something I'm going to talk about in my full training, the routes to go through and how the best interest does work. So this session was a taster. We've covered the basics, but the medication practice involves so much more detail and in real-time problem solving. If you'd like to go deeper, take part in interactive sessions, ask questions, and gain a CPD-accredited certificate of completion for your training file or CPC evidence, then I'd love for you to join my full training. So my training is on Friday, 20th of September, my first ever training on Eventbrite from 10 a.m. until 12 p.m. Doing it online. You can book your place today via Eventbrite. Got all the tickets ready and set up. The link below in this video and in the description. So thank you all for watching this data, and I look forward to seeing you in the live session.